Hello, and welcome to our channel, Jalul Wonderland. In this video we provide you all informations you'd wish to avoid the virus COVID-19. Older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing serious complications from COVID-19 illness. Learn how virus spreads. There is till now no vaccination to prevent coronavirus disease 2019 COVID-19. The best because of prevent illness is to avoid being exposed to this virus. The virus is assumed to move mainly from one to one. Between folks that are in close contact with one another within about 6 feet. Through respiratory droplets produced when an infected person coughs, sneezes or talks. These droplets can land within the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Some recent studies have decided that COVID-19 can even be moved by folks that aren't showing symptoms. Everyone should hands wash icon. Wash your hands often. Wash your hands often with soap and water for a minimum of 20 seconds, especially after you've been during a public place, or after blowing your nose, coughing, or sneezing. If soap and water aren't readily available, use a hand sanitizer that contains a minimum of 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. People arrows icon. Avoid close contact. Avoid close contact with folks that are sick, even inside your home. If possible, maintain 6 feet between the one that's sick and other household members. Put distance between yourself and other people outside of your home. Remember that some people without symptoms could even be able to spread virus. Stay at least 6 feet, about 2 arms length, from people. Do not absorb groups. Stay out of crowded places and avoid mass gatherings. Keeping distance from others is especially important for folks that are at higher risk of getting very sick. Head side mask icon. Cover your mouth and nose with a cloth face cover. When around others you could spread COVID-19 to others, albeit you're doing not feel sick. Everyone should wear a cloth face cover once they have to go away publicly, as an example to the grocery or to pick up other necessities. Cloth face coverings should not be placed on young children under age 2, anyone who has trouble breathing, or is unconscious, incapacitated or otherwise unable to obviate the mask without assistance. The cloth face cover is meant to protect people just in case you're infected. Do not use a face mask meant for a healthcare worker. Continue to keep about 6 feet between yourself et al. The fabric face cover isn't a substitute for social distancing. Box tissue icon. Cover coughs and sneezes if you're during a personal setting and do not wear your cloth face covering. Remember to always cover your mouth and nose with a tissue once you cough or sneeze, or use the within of your elbow. Throw used tissues within the trash. Immediately wash your hands with soap and water for a minimum of 20 seconds. If soap and water aren't readily available, clean your hands with a hand sanitizer that contains a minimum of 60% alcohol. Cleaning icon. Clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water before disinfection. Then, use a household disinfectant. Commonest EPA-registered household disinfectants. External icon will work. Head side medical icon. Monitor your health. Be alert for symptoms. Await fever, cough, shortness of breath, or other symptoms of COVID-19. Especially important if you're running essential errands, going into the office or workplace, and in settings where it's getting to be difficult to remain a physical distance of 6 feet. Take your temperature if symptoms develop. Don't take your temperature within half hour of exercising or after taking medications that might lower your temperature, like acetaminophen. Follow CDC guidance if symptoms develop. Thanks for watching. Please subscribe to our useful and funny channel.